Welcome to Health Modulus, where, as every week, we explore the decision shaping healthcare, life sciences, and digital innovation across the Middle East. Patients today may be able to find a doctor, laboratory, or pharmacy, but that doesn't necessarily give them continuity. Medical history, unfortunately, still remains fragmented, not just in the Middle East, but globally. Sometimes orders leave the consultation, and recovery may often happen outside of the clinician's view. So today, I'm very fortunate and lucky to be joined by Ahmad Shraim, founder and CEO of AloTabib. His route into health technology is very unique. He moved from civil engineering and physical infrastructure to building what he describes as digital infrastructure for healthcare. AloTabib is an early stage, Jordan first platform being developed to connect the patient journey through Arabic first, AI assisted navigation, and clinician led care. This isn't simply a conversation we'll have about another health application. We're asking what it would take to turn a product vision into trusted care and infrastructure. What AI should do, what must remain human, how patients retain control, and what evidence AloTabib must produce before it scales across the region. Ahmad, welcome to the Health Modulus.
Thank you so much, Dr. Bao. It's my pleasure to be here.
So, Ahmad, to begin, can you give myself and especially the audience a little bit of background about yourself?
Yes, definitely. So, I finished my high school here in Jordan, and when I was 18 years, I flew back to the United States. That's where I was born. So, I have a unique understanding of different cultures from the Middle East to American culture. So, I had the privilege to experience the different quality of healthcare in the United States and how it's different here in the Middle East. I went to the United States to study engineering, and during my study, I had the opportunity to establish my own business. And as you know, it was basically focused on engineering itself. So we have understanding how foundations and infrastructure could be very valuable for building a project or a product itself. Coming back to Jordan, I have noticed how a lot of technologies that I have used and experienced myself in the United States could be very useful here, but not if it's copied, if it's made custom to serve the population of the Middle East. We have different genetics, we have different DNA, and we have different culture. So, how can things that we have used back in the United States be used here to serve the population and give a better quality and access and continuity of care for the population here in the Middle East?
Great, great. No, that's excellent, and you touch on so many excellent points that are wonderful to hear from you, and we'll touch on throughout the conversation. So my first question that comes to mind is you talked about and I introduced AloTabib as a platform that can address one of the key things, which is the fragmentation of care and how there oftentimes is such a lack of continuity and also localization because your platform is specific for the Middle East region. But outside of that, a lot of these platforms are oftentimes born or created out of some type of personal frustration that an individual has. So maybe you can share what was that personal frustration that made you really think about the fact that I need to create something to address this, because it's not only a problem I'm seeing, but for myself personally, it's a frustrating issue that I have dealt with or am dealing with.
Yes, definitely. So, unfortunately, in 2020, I was diagnosed with the Crohn's disease, and I had to experience the healthcare system in depth because I have spent so much time in the hospitals. I'm going back and forth to see different providers, and the whole system in healthcare, not only in Jordan, but I was in the United States at the time. And as you know, Crohn's disease, it's not a you can't have a specialty doctor that can treat it or understand it. And especially in the United States, you have multidisciplinary providers that come together to diagnose you and give you a treatment plan. You have a GI doctor, you have orthopedics, you have immunology doctors. So I have tested the fragmentation myself, and I have seen how this can make the quality of care and the continuity of care uh, affect the patient themselves, not just the healthcare providers. And when I came here to Jordan, I have seen, let's say, the oldest school of doing healthcare in the region. I can tell you a personal story. So I was with my father once when we visited the doctor, and he had to see the doctor for high blood pressure that he's experiencing. And
Yes.
this visit was right a week after he did some imaging for MRI for him losing balance and feeling nausea all the time. So what really shocked me how we are in Jordan, and I'm not speaking about all the providers, but we still manage healthcare very old fashioned. Like you can go to the doctor, you have to tell your whole life story from beginning to end. And that wastes a lot of time just to understand the patient in front of you as a provider. And not only that, like as a doctor or as a provider, you have to rely on patient memory for them to give you the right context about their issue or the symptoms they're experiencing. What happened during the visit, it made me like think clearly. How can we make the journey not only for the patient, also for the providers? When the provider asked my father, like, what kind of medication you take now, he did not trust my father writing in a paper the medication itself. So he asked me to go back home and bring all the medication, put them in a bag, and go to show him what my father really taking, because he want to make sure my father dispensed the right medication. Is he, and like during the transition of care, did any mistake happen that can cause any of the symptoms that he's experiencing? I couldn't say the doctor is old fashioned or he's not doing his practice the right way. No, actually, he is giving a lot of care to make sure my father actually adhere to his medication correctly. Nothing happens in between, like dispensing the right medication or him taking maybe different medication at home. So these issues have made me realize that there's a gap in the market that we have to cover and fix so we can have continuity of care and also adherence to a good practice.
Excellent. What an excellent story, and it demonstrates exactly how these personal frustrations, whether you're undergoing them individually or someone from your family, can really translate into an excellent idea that can help the broader population. And you touched on a really interesting point in that in Jordan, other countries throughout the Middle East, healthcare is available, but there are often times where individuals have a problem with that continuity of care, or as you refer to, which we oftentimes call the transition of care journey. So, what, in your opinion, is that point of the patient journey or the transition of care that you think is most problematic, or where patients or their families and caregivers seem to have the greatest issue? And it may not just be one part, but what are some of those areas, maybe the top one or two, that you feel are most problematic that you're going to help solve with your platform?
Yeah, definitely. So if I want to summarize it in one word, I would say coordination. And with the help of the technology that we have now, we don't want to say we're going to use AI to orchestrate and using AI as the hype as we have right now. It's more of like having a companion and decentralize the care and access to the patient themselves. So imagine if you as a patient have a companion that goes with you in every single journey during your health, from symptoms intake to recovery to follow-up. So in a user journey in our platform, you start with an AI intake. So you as a patient, you can just express in natural language what you are having as symptoms or a complaint or chief complaint, and this will be structured in a way that can give the healthcare provider the context of your problem in a structured way. So this way, the provider can manage your care in subjective, objective assessment plan. So what you will see that the solution that we have actually coordinate the journey from the first chief complaint that you express to your provider, and it will follow with you. Like most of applications that we have right now, they stop at telemedication. You just have a virtual call with the doctor. This is good for access, and you can have the doctor anytime you need to talk to. But what happens after that?
Yeah.
Did the diagnosis and the prescription transition to the patient and he understand it in real time? Did he go to to the pharmacy and the dispensing of medication was accurate? If the doctor asked you to do lab orders, did you go to the lab and you received the results and these results were delivered to the provider and you as a patient has and have understood them the right way and in a simple, let's say in simple language, not just in a medical term. After that, let's say, have you followed your recovery plan correctly? Did you adhere to your medication on time? Did you see any symptoms? Like, let's say you see the doctor today and you're going to see them in the next 2 weeks. There's a gap that the doctor will not see until unless you call them or there's an
Hmm.
emergency. But what if you go back to the doctor to follow up and the doctor can see your adherence accurately in a structured data that can help you as a patient get a quality healthcare and the provider also have, let's say, tools. We don't see the AI as a solution. We see it as a tools. Do they have the tools to manage your recovery and help you recover faster or better and understand any details that happens in this recovery period that in a regular workflow that we have right now can be lost with memory, can be lost with uh, traditional workflow that we have right now. So to summarize it is the coordination layer, the orchestration layer that we have between symptoms, complaint to recovery and follow-up.
Great, great, great points. And one of the key things that I'll also add when I've had the fortune of looking at your platform is that it's also localized. It's in the Arabic language, which is key because a lot of platforms do have a capability, but they don't think about the local population at hand. And to me, that is one of the most important features that AloTabib can provide is that built-in localization. Because when myself, my company help a variety of organizations, that's a lot of what we have to do is the localization. But for you to have that already integrated is such an excellent part of the value proposition because it's already there. You're making it and developing it in a way that's already going to be impactful for the patients right at the beginning.
Yes, you're right. And luckily, AI has advanced so much that we don't just like resolve the language problem, also the accents. I'm very
Mm-hmm.
sure you follow and you have seen, like, for example, ChatGPT right now can understand Egyptian language, GCC language, Levant language, or North African language in general. So that can help us. Like if somebody wants to talk to a doctor and explain their symptoms to the AI intake, they can say like nose in Arabic language has maybe five different dialects that you can say the word nose in it. And now is the time where the technology has advanced, that we can also like store the data in a quality matter, that the language is not a barrier anymore, because we know like data analysis and data quality in English has so much metrics and quality that makes it very let's say very it was very accustomed to English, but right now with the advancement, Arabic language can come in hand, and we can store this data in a quality matter that we can analyze in the future and help with the future development of the solution that we are building.
Absolutely. And you also bring up another key point and value add is the integration of that artificial intelligence in your platform also helps learn from the patient as well. So as they're speaking and engaging with your platform in the localized way, the culturally sensitive way, the specific language and dialect, the system's also going to be able to move with them in the journey, so to speak. And that's important because it's seen as a continuous process. It helps with that continuity of care. And again, when I saw that and had you demo the platform, that's one of the key takeaways I had, is that the system doesn't stop. It continues to help the patient in a way that's actually quite comforting to the patient as well when we ran through an example. And I think that's something that the patients, especially here in the region, are going to appreciate. It's not going to be a single question or a single engagement if they don't want to, and that's it. It's going to be this continuous partnership, in essence, that they will be able to develop with the platform as well.
Yeah, definitely. It's instead of having an aesthetic feel of like a chatbot, it's more of an observational loop, if we would call it. Like
Mm-hmm.
you went to a doctor, you are home right now. So what's next? If you open the app, it can tells you like you have this prescription, you have this lab order. Would you like to go to the lab, or would you have to like to have a home collections? In the future, would the if when the regulation allow, like would you like your medication to be delivered? So it will be more observational, not like waiting for you to say something for it to give you a response. Also, like the recovery engine that we are building and we are developing, it's more of like, as it says, as a companion. It will analyze your visit, all the conversation that happens between you and the doctor, and will make sure you're adhered to. So it's like an agent core. So we'll wake up, let's say, every 4 hours. Have you taken your medication? Did you, when you take your medication, it will ask you by itself, by observing what happened. Do you have any symptoms related to this medication? And should we like also, it will not wait for you if it's so any like red flag of what do you think? Should we talk to a doctor? No, it will escalate the situation immediately if it's so there's an emergency. So your provider can take care of the issue in real time. You don't have to be in emergency room for the situation to be resolved. If the system has realized that there's a red flag arising from you experiencing some symptoms that the system can analyze based in your situation and your complaint or your diagnosis or your chronic disease, for example, it will directly observe this and escalate it to the right party, because we don't have to wait for you to uh, to chat, let's say, with the AI. No, it will observe what happened. It's a companion about the solutions that we are building.
Excellent, excellent. You mentioned the physicians and providers and how this system can, in essence, be that companion for the patient, the individual, throughout the day, nonstop, in essence. And one of the problems that physicians face is that they sometimes have too much sort of notification overload and whatnot. So, what do you feel that this platform will also ease from the physician side? Because we and a lot of organizations talk about the ability to help the patient, help their workflow, make their journey in their disease state easier. But we also have a tendency to forget about the physician, the nursing staff, the pharmacists, all of these individuals that are involved. What do you feel that this platform is also going to assist from that perspective? The ability to maybe ease that burden on the doctor and the dozens of patients that they may be seeing or trying to help manage on a daily basis.
Yeah, definitely. So if we look at the digitalizing of healthcare, if you're familiar with the Middle East, you can tell when you go to a hospitals or larger clinics that a lot of them have their own system that they developed in-house that can help them follow up the care for each patient. So if you go to a hospital here in Amman, for example, if I have visited this hospital and a year ago, if I go back by, let's say, my social security number, they can see that Ahmad has visited at this day and this is his complaint and all this stuff. But what if I went to a local small clinics here in Jordan and my health record has not transitioned with me? So what this platform will help is if I go to a doctor in any clinic, even if the doctor does not have the platform, I can simply just let him see my clinical record or medical record on my phone. Like, this is what I have been visiting. This is the doctor that I have seen. This is the doctor that I have seen
Mm-hmm.
after this diagnosis. And this will incentivize the doctor to join the platform to because they will see the value in it. Like, what if I have a to be platform and I have, let's say, I see 10 patients a day. I want to give let if we want to say like a good customer service perspective, I want to take care of my patients. Now I have a digital record for each patient that comes to my clinic. And if we want to see like how would that work in the future, imagine the doctor would have kind of a Jarvis dashboard where he come in the morning, he can look all his patients in a dashboard and seeing like, okay, this patient is adhering to his medication. This patient is coming tomorrow. Let me see how this his follow-up journey is going. So if the provider can see the patients and with a click of a button, see everything medical related to this patient, not only in his clinic, but also in other clinics. So he can cross-examine the data for better care, for let's say better quality of data that he can obtain through the system. Because as we say, it's not just gonna register like each visit and each timeline that the patient has in doctor clinic or specific doctor clinics, but it would also capture what's in between these visits. So the patient or the provider himself or herself, they can see a better outcome or better data quality that they can build their diagnosis on or build their analysis and observations from that.
That's excellent. And the fact that you mentioned the ability to also capture data is key because what the platform also has as a capability then is the chance and opportunity to capture real world data. And we all know almost any headline these days, especially in healthcare, life sciences, digital innovation, is all about real world data because we know that clinical trials will always be the baseline for interventional approval, whether it's a therapy, a procedure, or whatnot. But the ability to identify and capture data real time in a real world setting is so invaluable because, as you said, it really helps guide not only the physician, the doctor, their support staff, but it also helps to better inform the patient as well, their family, their caregiver. It gives them information that they can really provide. So the fact that the platform is also going to and does capture this real world data and evidence, in my opinion, is also one of the key attributes of it, because it's not only what the patients are going to appreciate, but the physicians, their institutions, their clinics, the executive leadership, even individuals that are in a financial role. The chief financial officer is going to appreciate that because they'll be able to understand how is this data translating or impacting our healthcare resource utilization, our costs that are associated with it. So I really want to applaud you for thinking about it from that perspective, because that real world data capture is extremely valuable, not only now, but it's going to continue being so valuable moving forward.
Yeah, yeah. Thank you so much. And not to forget, like if we have to apply a real world uh, arena, for example, pharmaceutical industry, when they issue any new medication to the market, they do
Mhm.
like extensive research through the years, right?
Yes.
And most of medication we know they have developed in North America and Europe, right? And they test this medication and a certain group of people or certain population, and then they release it to the market. So when they release it, when you read the medication, the medical any medicine like brochure, you can see like we have tested in this many population. This is the side symptoms that we have seen, and this is what we expect to see as any side effect. But what happens after that? Like, let's say you have tested to 100,000 people. Like, if you have issued the medication to Middle East market, we know the
Mhm.
population is different. We have different genetics. We have different environment, different climates, different DNA. If these data will be captured in a structured way, so the pharmaceutical industry can have a continuous real world data about this medication in this region, in this group of people, or it can like also can have more insight in the data in this, let's say, chronic disease uh, type of population. How did this medication perform in real world even after we have issued and published it in the market? So if this data has been structured in a way that, as you say, it can benefit government agencies, insurance payers, pharmaceutical industry itself, and also the researchers in the field. If some doctors are doing like deep data research of how real world data captured correctly and with the right quality can help medical research in the future. That is very valuable, and that's what we aim at AloTabib. Like through the years, that if when this applications is being adopted, how can we capture this data responsibly and in a quality manner that we can benefit our future research and make the quality of care uh, more more adhered to our populations and our region, not just copy whatever happens in the US or in Europe and just to bring it here. We have to custom make it to our needs. So that's something we really care about.
Uh, Great points, and not only you care about, but what the countries here care about as well. Because when you look at the authorities that review, register, approve the various drugs and procedures, that's what they're looking for. They're looking for local data and taking that into account because that's what matters to them. Certainly, you can have an amazing clinical study, and I've developed and ran clinical studies globally. But again, if there's little to no applicability to the people and the population in that country, it's really difficult to show that clinical, economic, and humanistic value to the population, because people will say, yes, it's been approved in the US or Latin America or the EU, but what about here? Has it been studied here? And the ability of your platform to help answer and contribute to that question uh, is absolutely brilliant. So thank you for doing that as well. So if we think about AloTabib 5 years from now, how do you envision or see AloTabib 5 years from now? What do you see it at that point?
5 years from now, we hope to see AloTabib as the health companion for patients here in the region. Not only the health companion for the region, but as a heavily adapted tools and solutions for the medical providers itself. Like, how could we would see like providers look at AloTabib as a way of uh, escalating their healthcare professionalism, and care providers will see the solutions as the answer to many fragmented issue and data silos that we suffer. For example, we know that the region here is underrepresented as uh, data aspects of the healthcare populations in the region. So if AloTabib could be the answer for these issues, this is what we aim for. We see it as the health companion that you as a patient will uh, just go to if you need not just to see a doctor or what the right physician to see, like what if we right now the product itself, it can answer you what specialties that you have to talk to. But in the future, if we capture the right data, we see a lot of people that can guide you not to the right specialist, but to the specialists that best fit your case, the specialists that have treated very similar cases that you have presented yourself. So if I right now as a Crohn's patient, if there are so many doctors that I can see, but what if AloTabib can capture the outcome and it has like an intelligence data layer that can tell me this doctor is the best doctor that can treat your solution and has positive outcome with similar patient that experience your issues. So that's where we want to see AloTabib in the future, that can when we capture this data, that we can analyze it in a structured way and in a quality that can really give us these outcomes for the patients, that can, when they want to see a doctor, they can see the doctor that best suit their case, not just the right specialists. So the data we capture, we hope AloTabib that can uh, really benefit the population here in the Middle East and the providers as well, for them to treat their patients, to have like a real world or a real time observation of what happened to their patient after they leave their clinics. So that's what we hope to see about AloTabib in 5 years.
Excellent, wonderful, wonderful. Ahmad, this has been a great conversation. I just wanted to give you the chance to say any last minute aspects about AloTabib or its future or what you have planned before we close this episode. But just wanted to give you a chance to say any final thoughts in closing about AloTabib, your work, and the hope and impact that you'll bring to the region.
Yes, we hope to current AI technology as the tool. We don't see it as the solution. Having AI would help orchestrate the healthcare operation and the healthcare transition through the whole journey. So we're trying to build a healthcare infrastructure and understand the technology that has to earn permission to do more than what we are doing right now.
Great. Thank you. Ahmad, just wanted to thank you again. The clearest takeaway that I'm getting from this conversation is healthcare access alone doesn't create that level of continuity or that transition of care that we need with patients. And closing that care loop requires not just physician authority, patient control, and reliable handoffs and proof that the system works, but it also means connecting with the patient. And AloTabib's opportunity here is extraordinary, it's innovative, and so is the responsibility that it carries with it, which is phenomenal. And that responsibility is to, and it already is, earning trust with one patient journey at a time. So, Ahmad Shraim, founder, CEO of AloTabib, thank you for joining us on Health Majlis, and well wishes, blessings, and continued success with your platform and what you're doing with the Middle East region.
It's my pleasure, Dr. Bao, and thank you so much for the initiative that you take in the region and helping modernize healthcare and make it better for the population in the Middle East.
Thank you. Thank you so much, Ahmad. Have a wonderful day.